pretty much have back pain every day. It's worse if I'm in a sitting position for any length of time. It's worse first thing in the morning.
Is it in the lower back or the upper back?
It's mostly in the lower back. And I had a MRI, and they did diagnose some bulging discs. And it's a back problem that I pretty much live with chronically every day in terms of soreness and pain. At certain times it will flare up. I don't know really what brings on flare-ups per se, but it just aches, like a throbbing ache, like a toothache in your back.
What have you done to alleviate the pain?
I take a lot of ibuprofen.
Join the club.
Yeah, so.
Have you been to a chiropractor, done any traction, inversion tables, anything like that to try to relieve the pressure on those discs?
I have not. Like I said, I just take a lot of ibuprofen every day. And like I said, well, I try to stretch my back out. And that's what has relieved when it becomes a throbbing toothache in my back. You know, some back exercises, stretching mostly. So, in other words, stretching it out to try to decompress probably those compressed discs. But mostly I take a lot of ibuprofen, and that I do find relief with that. But
helps to reduce the inflammation, therefore the pain. How is your back right now?
Sitting here, I don't notice it so much, but when I get up, I'll feel it. When I'm walking, I'll feel it.
You ready to try the machine?
Sure.
Let's get you strapped in.
I like the idea that you do have self-control, and you can push it to whatever limit that you feel is helping but not being painful or adding to the pain that you already have.
That was important to me because the physical therapist, they just put in an arbitrary number on the traction machine. For me, it was 160 pounds, and I had never had it before, and it pulled too hard. So I was sore, needlessly.
Now will I go from 5'3"3/4 to 5'4" 3/4?
Oh, you'll be 5'5" by the time you leave. Easily.
I like how you can ease into it. It's not somebody just setting, like you said, an arbitrary weight.
It's very gentle, so you can be extremely comfortable and relax those muscles knowing someone's not going to jerk on them.
I'd actually looked at that inversion table at, a warehouse store, and thought about, getting one at one point. My daughter-in-law has a lot of back problems, and of course I have a lot of back problems, and I thought maybe that would be a good investment. But I never really thought about, I also have high blood pressure, so I don't know how that blood rushing to my head would feel.
I tried the inversion therapy, and after hanging upside down for 10 minutes, I got a migraine that lasted 3 days. And I couldn't get enough pull in the right spot with just the weight of half of my body.
Well, this seems very balanced with the way the hip harness fits and the way the torso harness fits up under your ribs. It feels very equalized and balanced, and
No strain on any particular part?
no.
Great.
feels. It feels like if I did this on a routine basis, I could probably cut way back on that ibuprofen.
That's exactly how it was with me. I started using this every other day, and I don't take ibuprofen anymore.
Well, with all the literature out there about ibuprofen and all of its side effects with being bad for your heart and such, I'm kind of an advocate to try to get more relief with, well, it's kind of almost like exercising. It's like stretching your back, only it's like it's a traction, which is a stretch. I mean, it just makes sense.
Yeah, when I came to the realization that this kind of back pain is not curable, it's lifelong, that's when I made the decision to design the machine and to make it last a lifetime, and just knowing that I'm going to be married to it and it's just going to be part of life from now on. A few minutes every other day is not a bad price to pay, though, considering the alternative is to take pills the rest of my life and enjoy the damage that does.
To be able to have something like this in your home, where you don't have to drive someplace to get physical therapy, I mean, it's at your access anytime.
And you can recoup the cost over time because you're not paying the chiropractor or the physical therapist for each visit.
Well, I think you're gonna be a godsend, or this machine is gonna be a godsend for a lot of people out there that have these chronic back issues and will have for the rest of their life, unless they have one that's I mean, I don't even want to go to the surgical ones, because even people that I hear that actually resort to having surgery intervention, it's not always the cure. So I'd rather do something like this, kind of like exercising, for relief and for the benefits it will give you, than to resort to the pharmaceutical interventions or surgical interventions.
And many people like myself, there is no surgical benefit. And Barb, what do you do for a living?
I'm a nurse. I've been a nurse for 30 years. I did start out in adult critical care, but I now do babies. Babies don't complain too much about back pain.
But you know a little something about health care.
Yeah. I mean, just the benefits of even like laying here and giving yourself some therapeutic relief, emotionally, physically. I just think the whole idea of using something like this on a regular basis is good physically, spiritually, emotionally. I think people need to take the time out.
It's made a big change in my life. I no longer dread the car ride across town or to a town over, or sitting around the dinner table having to worry about the excruciating pain from sitting.
Well, you've sold me. Before Clark leaves, we'll have to pack pack one up, we'll save shipping and handling. We'll pack it up in the back of our truck.
That's how I carry mine around, in the back of the truck. You pull over on the side of the road when the back starts throbbing, and under an underpass when it's raining, and do the machine for a little while, get a good pull, and get back on the road.
The way you've designed it to be portable and wheels on one end. Slide it under a bed when you're not using it. It's a great design. It's a great idea, great concept,
Thank you.
and great back relief. Feels better.
Nice. Nice. Well, that's some very nice things that you said during during your pull. Would you recommend this to someone with
I would.
lower back pain?
I surely would.
Thank you, Barb.
I do.
Thank you very much. Awesome.